Hi, my name is Omar Ibrahim, and I am a board certified dermatologist out of Chicago Cosmetic Surgery and Dermatology in Chicago, Illinois. And I'm going to be talking about the latest trends in injectables, indications, and products. These are my disclosures as listed over here. The objectives, as we're going to go through them, is to discuss shifts in the aesthetic treatment paradigms and treatment goals. We're going to describe trends and patterns in filler rejuvenation as it pertains to the millennial patient. We're going to present new fillers and indications that are out on the market. And of course, we're going to go through some of the risks and the pitfalls of these newer trends. But I'm going to start by quoting one of my personal patients. This was a female patient, age 36, that was seen in consultation for a jawline enhancement treatment with filler. She said, "Let me be very clear. I am extremely happy with who I am and how I look, but sometimes you need a change. There's nothing wrong with wanting a different look from time to time." Now, this quote is very reflective of the paradigm shifts that we're seeing in the injectable world. In the last 10 years, we've seen an increase of almost 80% in soft tissue filler procedures. There's an increase in demand, awareness, and as well as supply of fillers. The clinician can target deep hollows, moderate furrows, and fine lines. And so with all these fillers, the clinician has become a master of anti-aging, but there is a shift in treatment paradigm. So what is this shift? Popular culture, social media, and an increased transparency has led to a rise in non-surgical treatments. And as we know, Instagram, Snapchat, and Zoom, among other social media, online and social media platforms, they've really changed the way we perceive ourselves. So the younger population is arguably the most health literate and fastest growing cohort seeking cosmetic consultations. So as my patient sort of alluded to, these younger patients are requesting treatments for jawlines, chins, cheekbones, lips, et cetera, for recreative and reconstructive purposes, rather than rejuvenative and replacing what they've lost with age. Google Trends analyses have showed that post-COVID-19, after the vaccine, this era has led to an increase in interest in lower facial procedures like lip lifts, lip filler, chin, and jawline. And industry has responded, and we'll go through that. So as I mentioned, the clinician recreates structures not originally present rather than rejuvenates what was lost with time. And this is something that's very specific to the younger millennial patient. What other shifts do we see? We also see a shift towards fluidity and the acceptance that sort of gender is sort of on a spectrum. Gender expression, I should say, is also on a spectrum, as well, as we see in a lot of these ads that have popped up in our mainstream media. So what are these gender shifts? Men are asking for chiseled cheekbones, under eye filler, even body modification like buttock enhancement. Women are asking for stronger jawlines and sharper chins. And so cis, trans, and non-binary individuals are looking to us, and they're seeking for enhancement in their physical features to reflect how they identify internally. Now, what are some of these pitfalls? I like to start with a PSA, really, a public service announcement. So we know that change can come with a cost. There's something well documented that's called the lipstick effect. This is the purchase of less costly luxury goods. Many times they're for DIY purposes, and the incidence has increased with COVID-19. We've seen unauthorized injectors injecting things like cement and motor oil in patients self-administering fillers at home. This can lead to burns, scarring, occlusions, vascular occlusions, and blindness. So there is a physical imminent danger to our patients. And that's why we have to stay on the forefront of these changing trends. There are also psychological risks and pitfalls. So what are the psychological implications? So this is a whole talk in and of itself, but I just wanted to touch on the idea of, or the concept of Snapchat dysmorphia, Zoom dysmorphia. It is estimated that almost 10% of cosmetic patients actually have some form of body dysmorphia. They have these, many patients can have unrealistic attitudes. They're constantly staring at sort of comparing these highly edited and distorted photos on social medias to themselves. This can lead to undiagnosed anxiety, depression, and as we mentioned, body dysmorphia and increased feelings of self-worthlessness. So we have to ask ourselves, where is the line between evolving your practice and pandering to impractical beauty ideals? You have to ask yourself, can I deliver an aesthetically pleasing, genuine result without feeding into unrealistic societal expectations and catering into an underlying dysmorphia. So this line is blurry, but at the end of the day, we must look at these trends, but we also have to look at the science and the evidence so that we can provide our patients with the safest, most effective treatments. So what are these trends and what are these treatments? So the first trend that I'm going to go into are the cheekbones. So the higher the cheekbones. So we know that malar rejuvenation, especially in the younger millennial population that really has not had time to lose a lot of their facial structures, their bone, their fat, malar rejuvenation is no longer reserved solely for anti-aging purposes only. Contouring, which is a technique which was really pioneered by drag performers to use makeup to feminize the face, lift the cheekbones, minimize the chin, things like that. That has become more mainstream in sort of mainstream culture where people were using makeup to enhance certain features of their face. There's an increased emphasis on heart-shaped faces, defined cheekbones, and sharp contours. And this is sort of a look that lots of young millennial patients seek. And the question is, can you recreate or enhance with filler what makeup has done for years? Now, you can't discuss cheekbones without talking about the Harmony study. Basically, in a nutshell, what the Harmony study showed, they used Voluma in this case in the midface, and they compared sort of the highest performing or best rated sites where they had the highest satisfaction rates to the sites that had lower satisfaction rates. And this is specifically looking at just Voluma and cheekbone treatment. And they showed that when you lose less and use it more intelligently, patients felt like they had, normal expression, no more movement, a softer, subtle, more natural look, and they ended up using less amounts of fillers. So the takeaway from this is lateral and less. Use less volume medially. The old way we used to do is to fill right into the sort of the medial cheek area. This can inhibit movement and smiling. And so you want to use less volume medially, and you want to focus on the lateral zygomaticomalar region. And you end up having higher success rates and end up using less filler. So the results of the Harmony study really validate what patients, especially social media savvy ones, are surmising online and they're seeking out in the real world. And of course, we know the caveat here, the overall patient satisfaction really depends on a multi-pronged approach. But when you're looking at rejuvenation, I always start at the cheekbones. So in response to this increased sort of awareness and seeking of malar rejuvenation, the industry has responded. So there are newer fillers and newer indication used in the malar cheeks. And this is really regardless of FDA indication. So Restylane Define, more and more people are using it in the cheekbones. Restylane Contour is a newer filler that we're going to be discussing in a little bit detail in just a second. Is FDA approved for mid-facial rejuvenation. The RHA 3 and 4 are being used in the mid-face for malar rejuvenation. These are softer fillers that can be used in younger patients that don't need much lift. And there is a rise in the use of Radiesse Plus, which it's a bigger bang for their buck, especially for when patients are more cost conscious because the syringe comes in at 1.5 ml. So let's talk about some of the newer sort of studies that came out just in the cheekbone arena. We can't do that without discussing this pivotal study that compared Restylane Contour versus Voluma for cheek augmentation. This was a multi-center study that comprised 15 US centers, and they did two groups, basically Contour versus Voluma and Contour needle versus Contour cannula. Needle versus cannula is an entire talk on itself, so we're going to ignore that group. We're going to look at Contour versus Voluma, and this will help answer your questions as to what's better, Contour, Voluma, if any. So this was the study design overall. Basically, patients were treated. There was an optional touch-up at 4 weeks. The primary endpoint was assessed at 12 weeks, and they were followed out for up to 48 weeks. And they used this Medicis mid-face volume scale to assess primary endpoints, but also to help them with their inclusion criteria. Patients needed at least a 2, 3, or a 4 to be included in this study. So this is what they saw. They looked at the primary effectiveness analysis. So the primary effectiveness was at least a 1-point improvement or a change from baseline. And when they compared contour versus Voluma, non-inferiority was established in both treatment groups. What does that mean? That results were extremely similar, not statistically significant between contour and Voluma. And the primary effectiveness points were met by 12 weeks for both Voluma and contour, with almost a 1.5 improvement, 1.5 point improvement in the mid-face volume scale. Now, looking at just the needle group again, because we're focusing on group A, they followed these patients. They looked at the blinded evaluators as well as the subjective. Just the blinded evaluators, where they looked at the improvement over time. And they showed that with the by up to 48 weeks, you see almost 65% still had at least that 1 grade improvement, which says that these products, both of them may last, as we know, at least with the Voluma, may last at least up to a year. Which is fantastic to know. Again, and one of the secondary effectiveness points they looked at was the Global Aesthetic Improvement Scale. And this is sort of they looked at the subject rated scales as well as the treating investigator, and extremely high numbers from week 12 up until week 48. At the highest being almost 100%. You can think of it as sort of satisfaction, where patients saw themselves as improved or better. And those numbers stayed extremely high, still not statistically significant between the contour and the Voluma. Now, when you look at adverse events, we always have to ask, with these, especially with these newer fillers, what do these adverse events look like? It's really what you would expect of any filler injection. So bruising, pain, facial pain, that was in the contour group, that's the GAL group. The control, which is the Voluma in this case, pain, edema, and erythema. Again, when you're looking at these, and if you're an injector, really, these should not be surprising. So what were the overall safety results? So the majority of subjects in both group A and B were reported. So these predefined adverse events. So these things that were expected. So there were no remarkable or unexpected adverse events. Although not statistically significant, a smaller proportion of subjects that got contour treatment reported pain, tenderness, redness, bruising, swelling, and itching. Now, keep in mind, this was a Galderma sponsored study. They made a point to point this out, and it's been published, but this is not statistically significant. These are just some representative photos. This was a 34-year-old woman that had a mid-face volume deficit scale score of 3 at the beginning, went down to 1, and then back up to 2 between 12 and 48 weeks, respectively, and almost 3 ml totals. This is another patient that a 35-year-old male patient, as expected, larger sort of face. He had almost 5 mLs and sustained improvement you see by 48 weeks. So moving on from the cheekbones, we're going to move down to the chin and jawline, because you cannot talk about millennials and their treatments without talking about chin and jawline, which I think is one of the hottest, fastest growing arenas in the aesthetic world. So the chin and jawline are integral determinants of not only facial youth and beauty, but as we sort of alluded to, gender identity. Gender identity is defined as an individual's personal sense of having a particular gender. And it can be fluid. It can be the same as their assigned sex at birth or not. And so as I alluded to earlier in the earlier slide, women are wanting more defined chins and jawlines, just as men wanted in the past. So we know that treating the jawline with injectables is on the rise. So both surgical and non-surgical options are available. But when it comes to that, personally, I believe when it comes to patients, especially younger patients, considering sort of implants, surgical implants versus filler, they almost always opt for the filler first, especially from a cost approach and a safety approach. These are what we consider sort of the quote unquote masculine features. When it comes to chin and jawline, I just want you to focus on the jawline, a large, more prominent chin and more prominent flexure of the ramus versus what we traditionally thought as feminine features, smaller chin, smaller angle of the ramus. But of course, keep in mind, everybody in between matters. This is an example of the importance of jawline filler. This is one of my patients. He's a cisgender male that said he always looked like a boy, never taken seriously, wanted a sharper chin and jawline. I used here a combination of different fillers. It depends on the day. If you ask me in my mood, I use the combination of Radiesse, which is calcium hydroxyl apatite, and Voluma in his anterior chin, and the calcium hydroxyl apatite was in the posterior portion. So you see significant change in his appearance. This is a transgender woman, pre-surgery, pre-hormones. She knew she had a year and a half left until insurance paperwork went through. And so she wanted a softer, more feminine chin jawline. Here I used a combination of Voluma and Restylane Lift for the chin. You see a softer chin. You don't have that sort of traditionally masculine broad chin. And I also used, and I want you to look at the masseters. So the masseter muscles, I used a significant amount of neuromodulator to sort of relax the masseter muscles, and a little bit of Restylane in the lips. Again, slightly fuller lips, slightly more feminine appearance. And these photos were taken 6 weeks apart because that's how long you should wait for the masseters to sort of shrink up after treatment. This is the side view. Again, much softer side view than the harsh, sort of more chiseled features. There are lots of scales that you can use when you're looking at the chin. There's the Steiner, Ricketts, and Burstone, but honestly, rule of thumb, I look at them from the side, look at where the chin ends. The most prominent feature of the chin, where it ends, it should be about right underneath the most anterior edge of the lower lip, or 1 to 2 millimeters max, more posterior. And that is my sort of rule of thumb way to do it. And it's never failed me. Use these scales or these diagrams if you want or don't. I don't use them because I find them sometimes a little confusing. So we can't talk about jawline and chin without discussing the new indications. Some of them are new fillers, some are not, but we're going to start with Radiesse. This, as I mentioned, this is Radiesse Plus. As I mentioned, this is calcium hydroxyl apatite with lidocaine. That's what makes it the plus. Overall, this is the study design, pretty similar to the last one, with a baseline treatment and a touch-up. Primary effectiveness point at week 12, and then they were followed up to week 48 and even week 60. And these are the key inclusion criteria, but basically they needed a 2 or 3, so a moderate or severe score on the MERS jawline aesthetic scale, which is a validated scale. And so what did they find? They found that they compared both needle and treatment and cannula treatment, but they found that they used a mean volume of about 2 mLs per jawline. So that should help you decide how many syringes the patient's going to need. They had different techniques depending on cannula versus needle. And of note, no patient was injected with more than 3 mLs of calcium hydroxyl apatite, which is 2 syringes per jawline per treatment session. And as expected for the touch-up visits, the median volume was a 1 to 1.25. And so what they saw in their primary effectiveness points, which as compared to the other study, was at least a 1-point improvement on the jawline scale. And over 75% of those treated with Radiesse actually achieved the primary effectiveness points. So clinically significant, of course, as compared to control. 94% of patients rated themselves as improved to very much improved. So we're talking over 90%, which is a 94% satisfaction rate. Sounds fantastic. And then they looked at as the patients rating themselves as significantly more satisfied. Over 75% of patients were satisfied after the treatment. And again, these numbers differ because you're really looking at 2 different things, the satisfaction versus how they viewed themselves. So the majority of the adverse events that they saw were mild and transient, and again, were expected if you do injections. pain, erythema, mass, and bruising. The majority of these adverse events lasted less than 15 days, and they all resolved without any sequela. There were no serious or unexpected adverse events. So this is a representative photo from one of the trials. I apologize, I don't have her age on here, but overall, she was a primary responder. You see significant improvement in the jawline, where you see a lifting of the lower face. Total volume used here was 2.25 mLs of Radiesse. This is a slightly older patient. And this patient of note, just as an aside, I would have started with her mid-face, her cheekbones. Again, never forget about the cheekbones, but this was a jawline study. And they used a little over, I would say this was probably one full syringe of calcium hydroxyl apatite, and this was her between baseline and week 12. Now, moving on to Volux, you can't talk about jawlines without talking about the newest player on the block, just released this month and will be disseminated widely January and February of next year. This is by Juvederm. Study design, again, very similar. Won't go belabor these points. They used their own validated jawline definition scale. They looked at patients that had moderate to severe. So again, very similar, a grade of 2 or 3. The median sort of volume injected, or the mean average volume injected, was a 4.35 mLs, and the at touch up about 2 mLs, and then at maintenance. So maintenance, this is actually important to point out. They had at month 12. They actually treated the patients that wanted to be treated and followed them out. The maintenance, of course, as you would expect, if someone got 6 syringes the year prior, is actually significantly less. And you might say, why are these volumes much higher than Radiesse? That's because they treated more expansive an area. So in the Radiesse trial, they just pretty much only treated the jawline. In this, they actually treated the pre-jowl, the marionette, the post-jowl, the chin, and the angle of the mandible. So this is the significant difference, why you see a significant difference in terms of the volumes used. When they looked at the primary effectiveness points, similar to the other studies, was the subjects with a 1-point improvement in both sides of their jaw, and there was a 70% response rate. They looked at the response rate over time, and this was following them from month 1 to month 12 when the study stopped. And when the first treatment stopped, I should say, before their maintenance treatment, they went from 80 to almost 60% of responders, which is fantastic. And of course, after the touch-up treatment, the number increases and stays elevated. They then looked at the global aesthetic improvement scales, and this was as rated by the investigator and the subject. The percent of responders that were improved or much improved, extremely similar between the subject and the investigating rater. By month 6, almost a 90% of the patients admitted that they were improved or much improved, and that number remained significantly elevated up to and beyond the maintenance treatment. We won't go through all of this, but the thing I want you to look at these is the blue and green bars are really high. So that's showing subject satisfaction really in the 90s, 70s, 80s across the board. We're talking over like a year and a half, a year and 3 months. I like that they included this in the study. They asked the question, would you recommend this to a friend? And 90 to 98% of patients said yes, they would. This is a representative patient. This is an older patient, of course, with Volux treatment to her jawline. And here as well, you see significant improvement. And these are showing their numbers and their amount of filler that was placed. Now, my last study that I'm going to go through so my take on Volux personally, and no conflict of interest here. I use all these fillers for the jawline. I am excited to try it. I have not tried it yet. Only word of caution is, of course, with any new products, any new indications, start small, start slow, and build your confidence from there. And that's what I plan on doing for myself. Finally, again, can't talk about the chin and jawline without Restylane Define. So we talked about Voluma, which was Allergan. We talked we talked about MERS, which was Radiesse. Again, great filler, as the Volux I'm sure will be. And here's the Restylane Define for chin augmentation and correction of chin retrusion. This was a study that was done over 11 US centers, about 140 subjects, very similar to all the trials that we've discussed. You go from baseline to week 48, and they were followed out for almost a year. They used the Galderma Chin Retrusion Scale, which is a 4-point scale, and they needed to have at least a 1 and a 2 or a 2-point or a 2 score on this scale. And again, keep in mind, this is just the chin study, not jawline. So they treated their patients. And again, at least a 1-point improvement was considered a primary responder, and they saw them at week 12. And 86% had at least a 1-point improvement in the GCRS scale. And this was statistically significant. Of course, then they looked at the secondary endpoint, which was and this was dependent on the blinded evaluators in this case. And they were looked at week 12, week 24, 36, and 48, just following out the primary responders. So they went from 86% responders to 73% responders. And again, very similar numbers to the other sort of studies that we saw with the other fillers. This is just consistent with what is out in the literature. And then they looked at the Global Aesthetic Improvement Scale. So they looked at the percent of subjects that were at least improved, so improved or much improved. Then this was the subjective scale as done by the investigator and the subject themselves. They went from almost 99, 100% global aesthetic improvement. Percent of subjects said that they were improved. And still high numbers between 85 and 96% by week 48. So we know that this filler may last at least a year. Again, they only went to week 48. Let's talk about safety, of course, as we discussed in other studies, really not about 14% of the subjects actually experienced a related adverse event. But as you would expect, most of them were mild and what you would expect from doing injections. And so what were those? So they saw some pain, bruising, swelling, and erythema. The mean duration, the mean onset, the mean duration of these sort of adverse events was almost 2 weeks or about 2 weeks, exactly what we tell our patients or should be telling our patients. And then the mean or days to onset of these adverse events was 11.5 days. Now let's talk about some adverse events that are delayed. So these to me are of a special interest. Now there was one case of implant site swelling, and it took 185 days till the time of onset. It was mild and it recovered within 4 days. Another patient developed a 6-millimeter nodule that formed 53 days later. That was mild and it recovered 74 days after it was discovered. So I really like this slide because it's important that once a patient is injected with whether it's a hyaluronic acid or calcium hydroxyl apatite, you have to keep in mind that these delayed events can still happen. And that's why these long-term studies are important. And long-term sort of hand-holding, long-term discussion and education and checking in with the patient is very important, especially these younger millennial patients. So these are some before and afters that underwent treatment with Restylane Define. This patient received a total of 4 mLs, and she was a primary responder, having chin retrusion score of 2 and down to a 0 up until week 48. And this is a slightly older patient that received, again, a total of 4 mLs and a primary responder, as we see in these scores below. So what are the conclusions? So the conclusions are that evolving patient demographics and beauty trends, they've challenged us to step up to changing tides. So there is This increased demand, awareness, and acceptance of these fillers has been met with an increased supply and new FDA indications, which we should all be, on top of, at least knowledge-wise. So although we must face new, unique challenges and unexperienced competitors, we still stand as the experts. So we have to marry evidence-based medicine, psychology, and art to rejuvenate, recreate, and reshape. Thank you.